Is chemotherapy very painful? I hear that it's a myth, and can you break that down for us?
Yeah. So as medical oncologists, so we treat with medicines, and medicines for cancer till some years back, the only medicine is chemotherapy, and that's why it's got a scare associated with it. Now, it's not that the scare comes from no problems at all. There are multiple problems with chemo. It's not that there were not problems with that. What used to happen is, in the earlier times, chemo used to be there were very limited types of chemos, and they were intense, and they had a lot of problems, and the side effects used to cause all the problems like nausea, vomiting, hair fall, weakness, low blood counts, diarrhea. Giving the chemo used to be painful. All those issues used to happen. But the supportive care has changed so much in the last few years. It has changed dramatically. Now, you hardly see patients having nausea and vomiting. There may be a little bit change of taste which happens, little nausea may happen, but then you hardly see that happening. Secondly, hair fall. Nowadays, you're talking of ways by which you can avoid some chemos which cause hair fall, or sometimes you use scalp cooling sets to reduce the hair fall. There are ways by which you try to start saying, can we do something more? Blood counts going down, infections are so rare nowadays with chemo. You have those growth factor injections which you give, and that takes care of it. The anti-vomiting injections have become so good that you hardly see patients vomiting. So, chemo per se has issues with it, but the supportive care has become so good that most of these problems are manageable. Now, even giving chemo used to be painful, and half the time when people said pain was because you used to put an IV line and give chemo. And in the breast cancer, when you give IV chemo with line, the whole hand would pain, it would get inflamed, and that could cause all the problems. Nowadays, we hardly do that. We just get a chemo port done. The surgical oncologists for us do it under local anesthesia. They put the port under the skin. Now, when we need to give chemo, we just put a needle and then give chemo, remove the needle, send them home. So there's no pricking patients, and that port's there for their whole treatment. So when you plan all this, you make chemo very, very manageable. Now, no one wants to use chemo if it's not to be used, but it is required for cure in many situations. And that's the reason why you keep emphasizing chemo is required, but the way you're going to do it, you're going to make it painless, you're going to keep the side effects to the least possible, and most of these patients are going to come out with no problems to chemo. Most problems with chemo are manageable. So I would say yes, if someone says chemo is painful, we tell them no, that's a myth. Chemo does have its issues with it, but all of this in the present era can be managed.